Most people know that Medicare eligibility generally begins when you turn 65. But what if there is a serious health condition that requires earlier support? Medicare eligibility is indeed different for individuals diagnosed with end-stage renal disease, or ESRD. For those with ESRD, Medicare can begin much earlier than the typical age of 65, providing vital health coverage during a critical time. This special eligibility exists because ESRD is a chronic and life-threatening condition that requires regular dialysis or a kidney transplant. The federal government recognized the immense financial and medical burden this places on individuals, and so created specific provisions for early Medicare coverage. Generally, coverage begins on the first day of the fourth month of dialysis treatment. However, if you participate in a home dialysis training program, your coverage can start even earlier, potentially in the first month you begin dialysis. To access this earlier eligibility, you will need to apply for Medicare through the Social Security Administration. It is essential to have medical documentation confirming your ESRD diagnosis and the start date of your dialysis treatments or kidney transplant. The Social Security Administration will evaluate your application based on these medical records and your treatment history to determine your exact Medicare start date. A crucial detail for ESRD eligibility is understanding when coverage might end. If you receive a kidney transplant, Medicare coverage usually continues for 36 months after the transplant procedure. However, if you no longer requiring immunosuppressive drugs to prevent organ rejection after the transplant, Medicare coverage will typically end 12 months after you stop needing those medications. Conversely, if you remains on dialysis, your Medicare coverage continues as long as you need the treatment. Knowing these specific rules for ESRD means that you or a loved one can secure essential health coverage when it is most needed, easing the financial stress and ensuring access to necessary medical care, empowering you to focus on your health and well-being without added worry.